And joining me now is Dr. Bose from Medical Center Hospital, and today we're discussing the opioid epidemic. So for people that don't know what's going on, explain to us a little bit about it.
It's the biggest epidemic right now since the HIV epidemic. This is big. I mean, so much so that in the emergency room, as an emergency physician, we're seeing patients come in dead from opioid overdoses. So what are opioids? Opioids are an opium-like substance, and it's derived from the poppy plants, the poppy seeds, and you squeeze out those seeds and you get the substance. About 12% of it's morphine-like substance, and from that we get other medicines you may have heard of: hydrocodone, oxycodone, dilaudid, morphine, and then illegal ones that are synthesized like heroin.
Interesting. And so to localize it, how often do you see that here in Midland, Odessa?
Often enough that we need to discuss this segment, and I hope you guys all watch it. I mean, this is becoming a medicine cabinet disease. It's our medicine cabinets where we get these narcotic medicines. We may use only 3 or 4 of the pills and we feel better. And then later we take those pills and they have street value, they're being sold, we're taking them, giving them to our friends, and people are becoming addicted on this. And what happens is when you take these medicines, they go to your brain and they affect the pain and reward center, and you feel good. And then your pain goes away, but then it's hard to come off it because you feel good and you want more, and then you want more. And then you withdraw if you don't have it, and then people switch over to heroin. So now when you look at the heroin addicts in the United States, it's not who you typically think of when you think of a drug addict. People are getting addicted to heroin, and they're coming into our emergency room and dying from this. You're going to have pain if you injure yourself, but it's better to have a little pain as you're weaning off or coming off those opioids than to have the emotional pain of becoming an addict.
And I know you had kind of talked a little bit about the trust your doctor, that you might not necessarily need a painkiller.
Right. Your doctors are not being, they're not lacking compassion when they're not giving you pain medicines. This is becoming a serious problem. 30,000 people a year die from this. And if you look at all the heroin addicts, 3 out of 4 of them became heroin addicts because of a prescription they received earlier.
Wonderful.
So this is a gateway.
Absolutely. Well, thank you so much for being here with us, Dr. Bose. And coming up next, Sarah Holden joins us with a look at sports.